a little bit about your work and all. Yeah.
Thank you so much for inviting me. Yeah, I'm Dr. Srivani Karna, integrative obstetrician gynecologist, PCOS fertility specialist. I mean, I integrate alternative medicine with allopathy. Okay, I'll treat naturally as first management. Okay, those PCOS. So I am suffering from PCOS to heal themselves naturally without medicines and with the help of integrative medicine. Okay, so what all integrative medicine will be included is like yoga, diet, exercises, all these are integrated. So yeah, I'm on a mission to help about 1 lakh women to heal themselves and achieve natural fertility and deliver healthy babies.
Wow, that's great. I wish it comes true and everyone can treat themselves with natural treatment, which
Yes.
is very good. You have very good mission. So I wanted to ask you a few questions about this, and we got some of the questions from audience also. We'll address those also in this live session. Yeah.
Sure.
So, Dr. Srivani garu, I want to know what is the difference between PCOS and PCOD?
Okay. So actually there is no difference. Both are same, but PCOS more it is more like it is not a disease. PCOS is a syndrome and not a disease. You should say disease when it is diagnosed with any one blood test. Okay, for example, diabetes, it can be confirmed with one blood. Okay, and like for example COVID, that can be diagnosed with one test, so that is a disease. Syndrome is a collection of symptoms. Okay, and diagnosis is also not so easy. We need to list out all the symptoms and we need to do various blood tests, and in those blood tests few will be related to PCOS. Okay, we will be considering those blood tests, and like we need to rule out other causes also. For example, irregular periods are there, so it may be due to other reasons as well, like prolactin or thyroid issues. So we need to rule out others. So it's so complicated. It's not so easy to do a diagnosis of this. So it is more of a syndrome and not a disease, but that's okay. That doesn't matter.
Okay, okay,
Yeah.
okay. Yeah, PCOD and PCOS same.
Yeah.
What is the major difference? Just irregular periods or something?
Yeah. So coming to diagnosis of PCOS, as I told, there is no difference between the PCOS and PCOD. Only the terminology is different, but as such, the disease is same. Okay, the syndrome, it is a syndrome. Okay, it is not a disease, it's a syndrome. Okay, so to diagnose PCOS, we need mainly the important category criteria hyperandrogenism, high levels of male hormones or symptoms, male kind of symptoms. Okay, that is very important criteria to come to diagnosis of PCOS. Okay, either blood test, blood report of like testosterone should be high, or symptomatically we should have acne or male baldness, that kind of excess hair, hirsutism, that kind of that is main. And we will take into consideration of two more parameters, like one is irregular periods, irregular or absent menses, and the third one is a scan report. In the ultrasound scan, we will see polycystic ovarian pattern. So in these two, any one we can take. Either they should have irregular periods, or they can have abnormal, like polycystic pattern in the scan. Both can be there. Sometimes what happens, they will have regular periods, but in the scan it will be polycystic ovaries, that way. So coming to a diagnosis is so complicated.
Yeah, it is difficult, no? So that means maybe if they are having irregular periods, then also they might have PCOS, right? Only without any other symptoms, only they have one symptom, that is irregular periods.
Yeah.
Can that also? Yeah.
Yeah. can be there, but mostly for them, the androgens also will be high, like testosterone or DHEAS is another androgen that will be high. Common will be associated with male symptoms.
Okay, okay. So, Dr. Srivani Garu, is there any other reasons for irregular periods?
Yeah, high prolactin levels, as I told, no, that is there, and sometimes thyroid abnormalities also can be irregular. Yeah.
Okay, okay. Yeah. Is it okay to have everything normal and still they're having irregular periods? Is it normal?
Um, like blood test reports, sometimes it may not be reflected in the blood test reports, but sometimes they can have.
Okay, okay. Okay. Yeah. My concern is, does that affect fertility also? Like,
Of course,
this.
yeah, irregular periods definitely affects fertility because problem of ovulation will be there, no, anovulation will be.
Okay. Yeah.
That leads to infertility.
Okay. So, my next question is, this is from audience. So, is PCOS and hair growth is related, and can you let us know how to eradicate that? How
Yeah,
to?
sure. Definitely, as I told, high testosterone is like hyperandrogenism is the main symptom of PCOS. No, so excess hair growth, unwanted hair, like on facial hair, where males have excess hair, the females will be having. So actually, symptomatically, people will be going for lasers and these treatments, right? Threading and waxing. But actually, if we work on our root cause, okay, like balancing our hormones naturally, like using food as medicine, exercise as medicine, sleep as medicine, sunlight as medicine. So we can naturally balance our hormones. We need to basically reduce the testosterone levels, increase the estrogen levels. So if we follow this over a period of time, naturally our is feet acne or excess hair, as you are asking about excess hair, that will definitely reduce, no doubt in that. But we need to be consistent in our action. It takes time, we need to be consistent. For temporary,
Yeah.
for time being, you can go for these treatments like maybe lasers or vaccines. But in long term, they can come.
Okay. Okay. So I heard that you are treating naturally with mainly with diet. 80% of the treatment done through diet. So how this that much effect will be there with the diet?
Okay.
Why it is?
Yes. So we are at root causes, right? So one of the root causes is poor gut health. Okay? Yeah. So it's a deep concept like root causes, poor root causes. So one of the root causes is improving health. No. So that's why as we food as medicine, if we improve our diet and timing
Okay.
food intake, that's also important. We can definitely see a lot of improvement in our health.
Yeah, yeah, yeah. It comes with other benefits also. One plus one of it.
Yeah, yeah.
It reduces PCOS problem and also improves the health.
Yes, yes. So PCOS is not only related to ovaries, it is overall health. Okay, it is more of like medical, like endocrinology than gynecology thing actually. So it involves various fields of medicine. Okay, it involves dermatology, involves even psychology, mood swings, right? So it involves various fields, but basically, if we address the root causes, all symptoms get better. We need not treat every symptom with different medication. By root causes, we can come out of all simultaneously.
Oh,
Yeah,
that's good.
even exercise can gut health. This will be strange to listen, we don't believe, but physical activity, mobility also improves the variety of gut bacteria. Okay, not only physical activity, so it is related to show impact on gut health. Okay, so
Okay.
yoga and all can have impact on gut health as well, the root cause.
Yeah, yeah, yeah.
Yeah.
Definitely. So we got another question. What happens to PCOS during pregnancy?
What happens to PCOS during pregnancy? Basically, in PCOS, the metabolic okay, metabolic will be poor, like cholesterol, um, tendency to land up in diabetes, okay, hormonal,
Oh,
thyroid hormonal imbalance. So if you continue without really optimizing, you may end up in complications like maybe you may be ending up in diabetes, miscarriage chances are more. Yeah, thyroid.
okay.
So it's always better to optimize your health before planning to conceive.
Okay.
Yeah.
Yeah, yeah, yeah. And one of our participants is having the PCOS, but now she got pregnant.
Mhm.
Will that PCOS come back after pregnancy,
Oh,
after the childbirth?
okay. I got your doubt. So yeah, so it is nothing like years after. It's nothing like that. It's because of our lifestyle. Unless you change your life, that is not going to.
So, if once we get into track
Hmm.
with the diet and yoga, everything, lifestyle, if we are continuing the same lifestyle with the healthy lifestyle, won't PCOS come back? It will be settled all the.
It will be under control. And here I want to explain one more thing. It is not a disease that has cure. Like it, for example, if we have infection, if you diabetics, that's get cured completely. PCOS is not like that. We should keep on addressing the root cause for lifetime. We should be following healthy lifestyle only. Okay. So not that you go back to your previous lifestyle and still you don't have PCOS. It's not like that. You should follow healthy lifestyle, but universal process is strict. But later it will not be so strict. You can enjoy all the food items like whatever you want, your junk foods, everything you can enjoy, but in a systematic way, occasionally like that.
Yeah, yeah, yeah. You can keep one day as a cheat day and you can have it,
Yeah, yeah,
maybe.
yeah.
Yeah. Uh, this answered the next question actually. Once PCOS or PCOD got reduced, there are chances that to get again
Yeah,
some
yeah.
after some time.
Since
Yeah, that we already addressed.
yeah.
Yes. So another question, how to cure cervix infection if it is repeating again and again?
Okay. So cervix, like you should first of all confirm if it is infection from cervix or vagina. Okay, so your doctor should diagnose it first. So if it is from cervix, basically you need to improve your immunity levels. Always, if you are having infection, something is wrong with your body, right? So always keeping on taking antibiotics, it will not help, right? So we need to improve our immunity levels first of all. Obviously, by improving your gut, your levels will improve. Apart from that, you need to take good, nice, complete course of antibiotics. Even if you want injectable antibiotics, you have to take, and along with that, probiotics you should. Okay, vaginal probiotics also you should take. Sometimes what happens, recurrent infections may they may acquire from male partners. So simultaneously, male partners also should be treated with the antibiotics.
Okay. Yeah, yeah, yeah. There could be, that is also, there is chance, right?
Yeah.
So it is well answered. The next question from the audience is PCOD can reduce the egg quality?
Yes, of course, yes. So in PCOS, basically there will be problem with the ovulation. So if you have a high insulin and inflammation in the body, the quality of egg may not be good. So it is basically problem with the genetics. Quality is basically the genetic quality of the egg may not be good. So if it fertilized, the quality of embryo may not be good. That may land up in miscarriages. So if the embryo is quality not good, inevitably that will land up in miscarriage. Whatever you do, how much electrons you give, whatever you do, that will not stay. Okay, that will up. Okay, so that's why miscarriages are common in PCOS. So we can prevent it by obviously improving health naturally, which is a tough job.
Yeah. So with this conversation, I got an idea that we have to take care of ourselves first before trying to conceive, right?
Yeah.
We have to, yeah, work on our PCOS so that it will be healthy for the baby and fetal growth also, right?
Yes.
So how much time we need to take, how much time before trying to conceive? We have to take care of ourselves. We have to
Minimum 3 months.
follow up the,
3 months strictly following the lifestyle.
yeah, that's okay. So, Arif is asking again, I had severe PCOS, but now I'm pregnant. Will it return after pregnancy? I think Arif, Dr. Shrivani ma'am already addressed this. You have to continuously keep your lifestyle in such a way which will help to reduce PCOS or to control your PCOS in limits. Is it correct, ma'am?
Yeah, yeah. So it is better to be in a good community, and you should change your environment also. Like you make your family also follow healthy lifestyle, so that you will be following long term.
Yes. Obviously, that will give others also a healthy lifestyle, right? Whole family will be healthy.
Yeah.
Okay. I heard that you are treating your patients naturally before allopathic treatment. So, can you give insights about your treatment for the sake of audience?
Okay. So if anyone with PCOS comes to me for fertility treatment, I don't directly give the treatment. Okay, like commonly nowadays everybody knows the letrozole tablet we will be giving for egg growth. Okay, so even if it is not growing with letrozole, we will be giving injections, HMG injections. We'll be giving. So in PCOS, what happens if you follow healthy lifestyle for first 3 months? Just one tablet will be enough for egg growth. They don't need injection. Okay.
Okay.
Yeah. Only if their health is not under control, if their health is very poor in condition, then only they will require injections. If they are in hurry, if they are very, in a hurry to conceive, then we will give.
Yeah.
But I personally don't give. First, suggest them to follow the healthy lifestyle, because there is no point in PCOS unless you follow healthy lifestyle. You are not going to enjoy the pregnancy as well. For the pregnancy, we have to give progesterone supplements, inject,
Hmm.
end up in complications also.
Yeah. And also there will be fear of fetal growth, right?
Yeah,
If
yeah,
it is not healthy.
yes, yes, yes. Yeah.
Yeah. Thank you so much for that answer. We have another question from Deepika. PCOS makes difficult to lose weight, and if you get pregnant with more weight, what happens? That's what her question is.
Um, yeah, definitely, it is tough to lose weight, but uh, try your best, do your best, just follow the healthy lifestyle. Whatever it is, that is second. It is not that even if you follow the protocols, you are not getting the results. It will not be like that. Follow the protocols, you will definitely get the result. It may take some time, for depends on severity of PCOS. For some people, it may take more time. Some people get faster results. Okay, in our program, some people are getting results in second month itself, second and third month itself. Some people are taking some time, like 6 months or even 1 year. Some people are taking. So it depends on person to person. Uh, so you will be feeling healthy. If not, if you don't lose weight, you'll be feeling in some other kind healthy, like be feeling fresh throughout the day. Like usually PCOS women feel tired and sleepy throughout the day. So if you are feeling sick and fresh throughout the day, like your toxins are reducing in your body. Okay. So in this case, like if you conceive, that's okay. You can continue. It's not that we need to terminate that. Like you can continue, but you can take help of small dose of progesterone supplement so that you don't land up in miscarriage.
Okay, okay. Does that weight gain in the due to PCOS, does that affect pregnancy or pregnant women? Excess weight of
Yeah,
pregnant.
yeah. As told, it is better to lose some amount of weight before planning to conceive, because in pregnancy they will be putting on extra 15 to 20 kgs, right? So putting on weight is not so healthy. Definitely losing weight before planning to conceive is good. If you conceive in uh, that weight itself, like a heavy weight, if you conceive,
Conditions.
uh,
Yeah.
that's okay. Follow healthy lifestyle during pregnancy. Okay, you eat healthy during pregnancy. It's not that you need to gain weight. You just eat healthy. That is enough during pregnancy.
Yeah.
And follow
Yes.
yoga. Yoga.
Yeah. 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 So, what you suggest for the pregnant woman? What is the minimum weight that they can gain? Healthy weight that I'm asking. What is the minimum range that we
Okay, so
can get?
we divide into trimesters. In the first two trimesters, weight gain will not be much. Like every month, like, on average, total around 11 15 kg gain, that is normal.
Okay. Okay. Yeah. Uh, my next question from audience is from Manoj Kumar. I got treatment from for PCOS, and again I got irregular periods. So may I know how to get pregnant?
Okay, so got treatment for PCOS for 3 months. That means they were put on 21 pills or something, right? It is an allopathic treatment only. I just want that information, like what treatment exactly? Is it allopathic treatment or Ayurvedic treatment or homeopathy? What it is? If it is a allopathic treatment, there is no treatment for PCOS in allopathy. Okay. Again, got irregular period means obviously, see, if you have taken 21 days, that evens your PCOS because they have no estrogen, just like six if we consume, so it will be replacing our natural estrogen function. So that is ultimately you have to address the root causes only.
Yeah, yeah, yes. That will be effective way, right?
Mm.
If you find out the root cause and we can treat exactly what is
Yeah,
needed.
you need to
Yeah.
spend your time. Definitely about 3 months of time you have to spend for reversal of PCOS, and you cannot be in a hurry.
Yes. Okay. So our next question from audience is Arib, is anterior lower placenta dangerous during pregnancy? I think she is.
Yeah, yeah. So it is nothing like dangerous. Okay, we just need to be careful. Low lying placenta, it may land up like may have spotting or bleeding issues during pregnancy. Um, So nothing dangerous with anti-proline as such.
Yeah.
Post
I think, sorry.
anterior is more dangerous, but anterior is not so dangerous. Yeah.
Okay, okay. That's okay. So our next question from audience, Safu. She is asking, what is the healthy weight for twins?
Healthy weight,
When
but with, huh? Okay. Uh,
in pregnancy, she meant in the
so
pregnancy,
weight
if
of
they are
twins
having
of her.
total weight, I think, because we discussed about the pregnancy weight, healthy weight gain. So she's asking for twins mother who is carrying twins, and what would be the minimum weight that we can get?
Okay,
I
so
mean,
I can tell you,
acceptable range of.
I can tell you if mother gaining weight will be even more. Okay, around 20 kg, mother will be. Fetal weight need not be more than 2.5 all the time. Okay, if there are two twins there, uh, even 2 kgs can be normal. 2.2 less than 2.45 can also be normal in case of twins. Yeah.
Okay. Yeah, I think we are done with all the audience questions. I have another question from the audience. This is like pregnant people after postpartum, they'll have mood swings and depression after few months of delivery. So, what is the root cause for that? What can be the cause, and how we can rectify and come to normal state?
Yeah, so postpartum loose, it is milder variety is common, but severe variety is not so common. It is because of sudden change in her life. Okay, of course, hormonal differences immediately after delivery it impacts. Um, so mainly the anxiety, the new thing came to life. So how to handle all these things? She might be anxious. That okay, that's one of the mainly the hormonal. So if it is severe, then you can take psychiatrist support, take proper medication for that. In milder case, support is important. Support from family, husband, so that helps actually. And doing yoga and that is also
Meditation.
meditation.
Yeah,
Yeah.
yeah, yeah, yeah. Yes. That's it. I'm just scrolling. If anyone's, oh, your voice is not clear. Okay. I think we answered every question from the audience. Thank you so much, Srivani Garu, Dr. Srivani Garu. It is a nice session and informative. We'll try to stay in touch, and the audience wanted to, if the audience wanted to join in your natural therapy. Oh, we got another question. Does ovulation happen when we have regular periods with PCOS?
Yes. So sometimes without ovulation also we can have regular periods. That is called
Oh,
cycles.
okay.
Yeah, even without period, without ovulation, you can have a regular. Yeah.
Mm-hmm. Okay. I think Archana does this answer your question. Yeah. Yeah. Okay, Srivani Garu,
Yeah.
thank you so much for answering every questions and your patience towards answering those questions. So let us know how we can contact you if we want any consultation regarding natural therapy of PCOS.
Okay. So as of now, I have a free online consultation link in my bio. Okay, they can book
Okay.
free consultation. It's going to be free for days. After that, I'm going to charge price. So
Oh,
I'm going to get webinars also. I'm getting ads in a few days actually.
okay, okay.
Yeah.
So guys, you can hurry up and book the consultation. It is free now. Yeah, whoever want, you can book the consultation. It is in the bio of Dr. Shrivani's profile. Yeah. Okay. Thank you so much, Dr. Shrivani Garu. We'll see you soon in next live
Thank you
session.
so much for inviting. Yeah.
Yeah, thank you so much. Bye, everyone. Thank you for joining. We hope we answered in every question of yours. Yeah. Thank you so much, everyone. We'll see you in next live. Bye bye. Have a nice day.